Overall, the symptoms are fairly similar to what adults or children present with, and those symptoms include diarrhea, include weight loss, can include rectal bleeding, abdominal pain. One symptom that's somewhat paradoxical in nature is the symptom of constipation, and it's not uncommon for older patients with IBD to actually present with a little constipation instead of diarrhea. Now, what other diagnoses need to be considered in the elderly patient who is presenting with symptoms that could be suggestive of IBD? Well, many things need to be considered that we typically wouldn't consider in the younger patient population. And those things include colon cancer, ischemic colitis, drug-induced colitis, microscopic colitis, radiation-associated colitis, and even a colitis associated with diverticulosis or outpouchings of the colon. The answer is not that straightforward. Overall, it would seem that they tend to have a milder form of disease. However, there's evidence to suggest the contrary as well. There was a recent systematic review that looked at the available studies of older IBD patients. And when they looked at the Crohn's patient population, the majority of those patients had inflammation that affected their colon, and the majority of these patients did not have complications such as narrowings or strictures and fistulas. When they looked at the ulcerative colitis patient population in this systematic review, the majority of patients had inflammation involving the left side of their colon. However, the proportion of patients that had that disease extend upwards to involve a greater portion of their colon was roughly the same as you would expect in adults. Now, in terms of the use of biologic therapy or anti-TNF therapy, such as infliximab or Remicade or adalimumab or Humira, the use of these therapies were less in older UC and Crohn's disease patients compared to the younger patient population. Now, it's unclear if that's because, again, do they have less severe disease, or are practitioners more cautious in using biologics in the older patient population? And lastly, in this systematic review, they looked at the need for surgery after 5 years. And actually what they found is that the need for surgery in both Crohn's disease patients and ulcerative colitis patients was actually similar to that of the adult onset IBD patients. Again, putting into question, is the disease truly milder? Now, what I do want to stress as well is that it's important to understand that older patients with IBD can vary in terms of how their trajectory is depending on where they live. So for example, there was a large French study looking at older onset Crohn's disease patients. And in this patient population, they found that the majority of them, again, 78%, had inflammatory Crohn's. So very few had strictures, very few had fistulas. And over time, as they followed them, only 10% converted to a more complicated phenotype. This is very different than what you would expect from pediatric onset or even adult onset Crohn's disease patients. Now, on the contrary, if you look at a cohort of ulcerative colitis patients followed in Hong Kong, and when they compared the elderly onset ulcerative colitis patients to the non-elderly onset ulcerative colitis patients, what they found is that a greater proportion of elderly onset ulcerative colitis patients actually had their disease extend to involve more of the colon than the non-elderly onset ulcerative colitis patients, suggesting perhaps that the elderly onset ulcerative colitis patients in Hong Kong had a more aggressive disease course. So overall, there is a suggestion in population-based studies that the disease course might be milder in the older patient population. However, the answer is not 100% clear.